Welcome to our exploration of how communities play a vital role in supporting healthcare leadership. In today's complex healthcare environment, leaders face numerous challenges from resource allocation to staff morale. But they don't stand alone. Communities, whether patients, families, or local organizations, are essential partners. Their involvement can shape decisions, provide feedback, and offer encouragement. Throughout this video, we'll uncover the many ways community support strengthens healthcare leadership, making a real difference in outcomes and experiences for everyone involved. When we talk about community in healthcare, we mean more than just the people who live nearby. Community includes patients, families, advocacy groups, local businesses, and even online networks. Each group brings unique perspectives and resources. Healthcare leaders who recognize and engage these diverse voices can better understand the needs and values of those they serve. This broad definition of community is the foundation for building strong, responsive healthcare systems that truly reflect the people at their core. Healthcare leaders are tasked with making tough decisions every day. But without input from the community, these decisions can miss the mark. Community members offer real-world insights and lived experiences that leaders might not see from their offices. By involving the community, leaders gain a clearer picture of what's working and what needs improvement. This partnership leads to more effective policies, better patient care, and a stronger sense of trust between healthcare providers and the people they serve. Trust is the cornerstone of effective healthcare leadership. When leaders actively engage with their communities, they demonstrate transparency and a willingness to listen. This engagement can take many forms, from town hall meetings to patient advisory boards. By opening channels for honest dialogue, leaders show that they value community input. Over time, this builds a foundation of trust, making it easier to implement changes and navigate challenges together. Policies in healthcare aren't just made in boardrooms, they're shaped by the voices of the community. Leaders who seek out and act on feedback from patients and families can create policies that are more responsive and effective. This feedback loop ensures that policies address real needs and concerns rather than assumptions. It also empowers community members, making them feel heard and valued in the decision-making process. During times of crisis, such as a public health emergency, community support becomes even more crucial. Leaders rely on the community for timely information, resources, and cooperation. In return, communities look to leaders for guidance and reassurance. This mutual support helps everyone navigate uncertainty and respond more effectively to challenges. Strong community ties can make all the difference in how well a healthcare system weathers a crisis. Patient advocacy groups are a powerful force within the healthcare community. These groups amplify the voices of patients and families, ensuring their concerns are heard by leaders. By working closely with advocacy organizations, healthcare leaders can identify gaps in care, address systemic issues, and develop solutions that truly meet patient needs. This collaboration leads to more patient-centered care and a stronger, more responsive healthcare system. Local organizations, such as nonprofits and faith-based groups, often have deep roots in the community. They understand local needs and can mobilize resources quickly. Healthcare leaders who partner with these organizations gain valuable allies in promoting health initiatives, reaching underserved populations, and building trust. These partnerships create a network of support that extends beyond the walls of healthcare facilities. Volunteers are the unsung heroes of many healthcare systems. From assisting with events to providing companionship for patients, their contributions are invaluable. Leaders who engage and support volunteers not only expand their reach but also foster a sense of community ownership. Volunteers bring energy, compassion, and a personal touch that enhances the overall patient experience. Community health initiatives, such as vaccination drives or wellness fairs, are often led by healthcare leaders in partnership with local groups. These initiatives rely on community participation and support to succeed. By involving the community in planning and execution, leaders ensure that programs are relevant and accessible. This collaborative approach leads to better health outcomes and a stronger sense of shared responsibility. Education is a key tool for empowering communities and supporting healthcare leadership. Leaders often spearhead awareness campaigns on topics like disease prevention or healthy lifestyles. By working with community members and organizations, these campaigns can reach wider audiences and have a greater impact. Education fosters informed decision-making and encourages proactive health behaviors. Cultural competence is essential for healthcare leaders working in diverse communities. Understanding and respecting cultural differences helps leaders build trust and deliver care that meets the unique needs of each group. Community members can provide valuable insights into cultural practices, beliefs, and preferences. This knowledge enables leaders to create inclusive policies and services that resonate with everyone. Marginalized groups often face unique barriers to healthcare. Leaders who actively listen to these voices can identify and address disparities. Community forums, surveys, and outreach programs are effective ways to gather input from underrepresented populations. By prioritizing equity and inclusion, healthcare leaders can ensure that everyone has access to quality care. Innovation in healthcare doesn't always come from the top down. Often, community members are the source of creative solutions to local health challenges. Leaders who encourage and support grassroots innovation can tap into a wealth of ideas and energy. This approach not only leads to more effective solutions but also empowers the community to take an active role in their own health. Transparency is a hallmark of strong healthcare leadership. When leaders are open about their decisions and actions, they build credibility with the community. Accountability mechanisms such as public reporting or community advisory boards ensure that leaders remain responsive to the people they serve. This openness fosters a culture of trust and continuous improvement. Shared decision-making is a collaborative process where leaders and community members work together to make important choices. This approach values the expertise of both healthcare professionals and the lived experiences of patients and families. By sharing information and considering all perspectives, leaders can make decisions that are more likely to be accepted and successful. Community advisory boards are formal groups that provide input and guidance to healthcare leaders. These boards are made up of diverse community members who represent different perspectives and interests. By consulting with advisory boards, leaders can ensure that their decisions reflect the needs and values of the broader community. This structure also provides a regular channel for feedback and dialogue. Stories have the power to connect people and inspire change. Healthcare leaders who listen to and share stories from the community can humanize their work and build empathy. Personal narratives highlight the real-world impact of policies and decisions, making abstract issues more relatable. Storytelling also encourages community members to participate and share their own experiences. Recognizing and celebrating community achievements is an important part of leadership. Whether it's a successful health campaign or an improvement in patient outcomes, celebrating these wins boosts morale and motivates continued collaboration. Leaders who acknowledge community contributions foster a positive, supportive environment where everyone feels valued. Social determinants like housing, education, and employment have a major impact on health. Leaders who work with the community to address these factors can improve overall well-being. Community partnerships are essential for tackling complex issues that go beyond the healthcare system. By addressing social determinants, leaders help create healthier, more resilient communities. Technology offers new ways for leaders to connect with their communities. Online forums, social media, and virtual town halls make it easier to gather feedback and share information. By embracing digital tools, leaders can reach more people and foster ongoing engagement. Technology also allows for real-time communication, making it easier to respond to community needs quickly. Mental health is a growing concern in many communities. Leaders who prioritize mental health support create environments where people feel safe seeking help. Community partnerships can expand access to resources and reduce stigma. By working together, leaders and community members can promote mental wellness and ensure that everyone has the support they need. Young people are the future of healthcare leadership. By involving youth in decision-making and leadership development, communities can cultivate the next generation of leaders. Youth bring fresh perspectives and innovative ideas. Leaders who mentor and empower young people help ensure the long-term success and sustainability of healthcare systems. Healthcare challenges often require collaboration across different sectors, such as education, housing, and transportation. Leaders who build partnerships with other sectors can address root causes of health issues more effectively. Community involvement ensures that these collaborations are grounded in local needs and priorities, leading to more comprehensive solutions. Communities often have resources that can support healthcare leaders, from funding to volunteers to expertise. Leaders who tap into these resources can expand their capacity and impact. Resource sharing builds a sense of collective responsibility and strengthens the bonds between healthcare organizations and the communities they serve. Healthcare is constantly evolving, and leaders must stay up to date with new knowledge and skills. Community members can play a role in this learning process by sharing their experiences and insights. Leaders who foster a culture of continuous learning create environments where everyone is encouraged to grow and adapt together. Diversity is a strength in any community. Leaders who celebrate and embrace diversity create more inclusive and effective healthcare systems. By recognizing the unique contributions of different groups, leaders can build environments where everyone feels welcome and valued. This inclusivity leads to better outcomes for all. Effective leaders are responsive to the changing needs of their communities. By staying connected and listening to feedback, leaders can adapt their strategies and services. This responsiveness builds trust and ensures that healthcare systems remain relevant and effective, even as circumstances change. Resilience is the ability to bounce back from challenges. Leaders who foster resilience in their communities help people cope with adversity and recover more quickly. Community support networks, mental health resources, and emergency preparedness plans all contribute to resilience. Strong leadership and community collaboration are key to building resilient healthcare systems. Leaders can encourage healthy behaviors by working with the community to promote wellness. Initiatives like exercise programs, nutrition workshops, and smoking cessation campaigns are more successful when the community is involved. By creating supportive environments, leaders help people make healthier choices and improve overall well-being. Clear and open communication is essential for effective leadership. Leaders who communicate regularly with their communities build trust and keep everyone informed. Communication channels like newsletters, social media, and public meetings make it easier to share updates and gather feedback. Good communication ensures that everyone is on the same page. Measuring the impact of healthcare initiatives is a shared responsibility. Leaders and community members can work together to track progress and evaluate outcomes. This collaborative approach ensures that programs are meeting their goals and allows for adjustments as needed. By measuring impact together, everyone stays invested in success. Barriers like transportation, language, and cost can prevent people from accessing healthcare. Leaders who work with the community to identify and address these barriers can improve access for everyone. Solutions might include mobile clinics, translation services, or financial assistance programs. Removing barriers ensures that no one is left behind. Preventive care is essential for maintaining community health. Leaders who promote screenings, vaccinations, and regular checkups help prevent illness and reduce healthcare costs. Community involvement is key to increasing participation in preventive care programs. Together, leaders and community members can create a culture of prevention. Change is a constant in healthcare. Leaders who adapt quickly and involve the community in the process are more likely to succeed. Community input helps leaders anticipate challenges and develop solutions that work in the real world. Flexibility and collaboration are essential for navigating change together. Ethical leadership is grounded in the values of the community. Leaders who act with integrity and respect for community values build lasting trust. Community input helps leaders navigate ethical dilemmas and make decisions that reflect shared principles. This alignment strengthens the relationship between leaders and the people they serve. Community leaders play a vital role in supporting healthcare leadership. These individuals often act as bridges between healthcare organizations and the people they serve. By recognizing and collaborating with community leaders, healthcare leaders can build stronger partnerships and reach more people. Community leaders bring credibility and local knowledge that enhance healthcare initiatives. Sustaining change in healthcare requires ongoing community involvement. Leaders who engage the community throughout the process are more likely to achieve lasting results. Continuous feedback, adaptation, and celebration of progress keep everyone motivated. Long-term change is a shared journey, and community support is essential every step of the way. Families are a crucial part of the healthcare community. Leaders who involve families in care planning and decision-making improve outcomes and satisfaction. Family support provides emotional strength and practical assistance for patients. By recognizing the role of families, leaders create more holistic and compassionate healthcare systems. Peer support groups offer a unique form of community support. Leaders who facilitate peer support create spaces where people can share experiences and advice. Peer support helps reduce isolation, build confidence, and promote recovery. This approach complements professional care and strengthens the overall support network. Faith communities often provide spiritual and practical support to their members. Leaders who engage with faith groups can reach people who might not otherwise connect with healthcare services. Faith leaders can help disseminate health information, encourage participation in programs, and provide comfort during difficult times. Feedback from the community is a valuable source of learning for healthcare leaders. By listening to concerns and suggestions, leaders can identify areas for improvement and celebrate successes. Regular feedback sessions create a culture of openness and continuous improvement, benefiting both leaders and the community. Different communities have different needs and expectations. Leaders who adapt their leadership styles to fit the community context are more effective. Flexibility, empathy, and cultural awareness help leaders connect with diverse groups and respond to unique challenges. Adaptive leadership strengthens relationships and improves outcomes. As healthcare continues to evolve, the role of community support will only grow in importance. Leaders who invest in building strong community partnerships will be better equipped to face future challenges. Together, leaders and communities can create healthcare systems that are more responsive, equitable, and effective for everyone. In conclusion, community support is a cornerstone of effective healthcare leadership. By working together, leaders and community members can overcome challenges, drive innovation, and improve health outcomes for all. The journey toward better health is a shared one, and every voice matters. Thank you for joining us as we explored the vital role of community in supporting healthcare leadership.